Ena mana whenua, tēnā koutou. Rauraka tira mā, tēnā koutou, tēnā koutou, tēnā koutou. Kua tai maiki te kōrero rero, mō he oranga haora. Tēnā koutou, tēnā koutou, tēnā tātou katoa. On behalf of the whole Hea Rangi Aora team, I would like to welcome you and to thank you for being here. You have, I think, already heard from the Minister the importance of this kōrero, which I think is a much more appropriate word to use for what we hope to achieve today. One of the members of our governance group said, "You can't possibly call today a colloquium. Nobody knows what a colloquium means." And I think that was really a very good introduction to the kind of day that we really want to have today. We want to have a kōrero, we want to have a conversation, not a one-way communication. So the Minister has rather taken the steam out of what I was going to say. In fact, I wondered if Jean here had actually sent him a copy of the slides, because he looked as if he had some kind of secret access to what I was going to say. But perhaps I can just expand a little bit on some of the things he said. I think probably everybody who's here today, or certainly most of you here today, are aware that the science challenges are a completely different way of looking at research from the way we have gone about things up to now. This is mission-led research. We are really working towards a mission rather than simply progressing research step by step from the starting point. But I think two aspects that I particularly want to emphasize. One is the importance to our work of Vision Mātauranga, which really underpins everything that we are doing. And the point that the Minister has already made, and that is stakeholder engagement. We want to engage with stakeholders. We have engaged with our stakeholders, not perhaps as much up to now as we would like to have done, because we had to be up and running very quickly, but certainly from now onwards, now that we are up and running, working with stakeholders is a key aspect of our work. Not only to help direct where we go in the future, but of course anything that we produce has to be translated into practice. And our stakeholders are the way in which the work that we do can be translated. So it is kind of different from things that have gone before. The Minister has already mentioned the importance of NCDs, which of course is the reason for our existence, and I think Robert Beaglehold is going to talk somewhat more about that in a few minutes. But Healthier Lives has to concentrate, I mean this is our brief, not on all NCDs, but specifically on the four major NCDs: cancer, cardiovascular disease, diabetes and obesity, but in particular taking into account the inequities of outcome that we are faced with now. I am slightly hesitant to show the slide because it's certainly incredibly ambitious, but I think it is very important in mission-led research to remember what our mission actually is. And our mission, which has really been in place from the very earliest time that we started to talk about this challenge, is to deliver the right prevention to the right population and the right treatment to the right patient. And I hope you will be able to see this theme coming through in the programs of work that we have proposed and the actual projects we have funded so far. Our aspirational target is scary. It is the WHO aspirational target of reducing the burden of NCDs by 25% by 2025, but also to reduce inequalities, health inequalities, by the same percentage by the same year. And I don't think anybody in this room needs to know how, needs to be told how difficult this target actually is. And of course, the point that I wish to make here is that it is totally impossible for us to reach this target on our own. This target can only be done in collaboration with our stakeholders. And I'll say a bit more about that in a moment. So a little bit of structure. The challenge is hosted by the University of Otago, but it is very much in collaboration with 9 other institutions, which I think I showed on the first slide, and I think are shown in your program. The sum of money that we have available for the first tranche of funding is minuscule when you think of the work that we have to do, but certainly it is our hope that through collaboration we will be able to do a lot more than we could otherwise have done for 13.3 million, and I'll show you one example of that in a moment, particularly given that we are expected to cover public health, clinical and biomedical research. This formidable diagram was produced by somebody in this room, Catherine Day, whom I would like to actually add to the names of the 2 people who were mentioned earlier, who were very pivotal in helping to set up the challenge. And we owe Catherine a lot in addition to this complicated diagram. But it really shows, I think, the structure under which we are operating, and really I said irritates. That was what a terrible lapse. I meant to say indicates. I promised you it was not intended. But it does indicate the very different structure from the normal research structure that we have. I mean, in biomedical research, we have responsibility to the university, we have responsibility to the HRC or other funding bodies that have funded research. But here we have this complex relationship. We are accountable to a governance group who has got a strong accountability to MB. We have a management group consisting of a director and deputy directors, a science leadership team who have working with them research teams, and an engagement to either side of the stakeholders, the engaged knowledge user group, I'll just mention in 1 minute in a little bit more detail, also a science advisory panel and a kahui maari, all of whom play an absolutely pivotal role in the functioning of the challenge. The Minister actually read out the research programs that we developed at the very early stage in response to our early consultation that we had with stakeholders, and I hope you will see in looking at this list the mission running through the right prevention for the right population, the right treatment for the right patient comes through, I hope, in seeing the list of research programs. And I'm not going to talk about the funded research programs because you're going to hear about these during the course of today. All the challenges are required to have a contestable funding round, and we have been very fortunate in being able to set up and develop and work with some partners, the Ministry of Health and the Health Research Council, in developing this long-term conditions funding round. So we have a pot of $7.9 million over a 3-year period. And if you look carefully at the list of funded projects, you will see that there wasn't a specific diabetes project, but we hope that a diabetes project will emerge in this contestable funding round in collaboration with the Ministry of Health and the HRC. This is in process right now, and we hope that the results will be available, the outcome will be available well before Christmas. Finally, to end with, I just want to come back to the issue of stakeholders who play such a pivotal role in the challenge. We had some initial consultation and discussion with stakeholders when setting priorities back at the end of 2014 and the beginning of 2015. Today we regard as absolutely pivotal, and you heard from Jenny that we really want today to be a kōrero. We want to hear from you, as well as letting you hear from some of the researchers who are involved. We've got a symposium coming up in Auckland early next year, and in the future we'll be having many further opportunities of talking with our stakeholders. We have started a process of talking to some of our key stakeholders, the organizations that are involved in diabetes, cancer, and cardiovascular disease. But as one of the members of our governance group said, we've actually got over 4 million stakeholders. Every New Zealander is a stakeholder in this challenge, and we need to find ways of communicating with as many groups as we possibly can, and that is something we all regard as our priority. We have a recently appointed Knowledge Exchange Manager, Fleur Templeton, who's going to be leading all this and advising us, and she's going to be somebody that I hope you'll all be in contact with in the near future. So Fleur is this person sitting here in the front row, and I hope you'll see some more of her during the day and in the future. So that is all I wish to say by way of introduction. Thank you again for being here, and I hope the day turns out to be an enjoyable and worthwhile one for you, and I hope there won't be any more serious lapses such as the one I made, and I know my colleagues are not going to allow me to live that one down in a hurry. So thank you.